So, Mounjaro, what is it? What does it do for you? So this is a medicated weight loss system. You would need to get a consultation with a qualified prescriber to assess your suitability for the treatment. But essentially, this simulates your GLP-1 hormone, which allows the insulin resistance in your body to be reduced, ending up in weight loss. You would start on a lower dose. Mounjaro itself comes in 2.5 milligrams to start with, injecting once a week to get your body used to having that medication inside. Once you've reached your dosage of 2.5, your prescriber will then speak to you about increasing your dose, staying on the same dose, dependent on the reaction you're getting. Now remember, this has to be a suitable treatment for you individually, which is why if you click our link, you'll be able to get our online consultation form filled in and you'll be put in touch with a prescriber who will coach you through it every step of the way. So the dosage of Mounjaro, I'm going to remove the pen from the box, pop off the lid. You're also going to need to get yourself a pre-injection swab that is 70% alcohol, just to cleanse the top of the pen and also to cleanse the area of the skin you choose to inject it into. So I'm going to do that now. I'm going to get that, wipe the surface so that there's no bacteria where you're about to introduce the needle. The needle itself is encapsulated with like this. You'll take the cap off the end, which reveals the first end of the needle. This end is going to go into the Mounjaro pen. So you pop it on the end, screw it down until it won't go any further, and pop the first cap off. This is now ready to start drawing up the injection amount. As you can see in the window here, it's set to 0, and I'm going to twist that clockwise until I can see a number 1 in that window. Once you see the number 1, you do want to prime the needle, so push a small amount of product through the needle so you're not then injecting air into the skin before you administer the medication. I'm going to pop this blue part of the needle off, squeeze a small amount out of the end, and you can see a little blob come out of the end of the needle there. That means there's no air in there and you are safe to inject. So you now have a choice as to where you want to inject this into your body. There are a few key places, making sure that we inject it into fatty tissue, not into muscle or just skin. The most popular area, I would say, is in the lower tummy. You can either do one side of your belly button or the other. It tends to be slightly more painful above the belly button, so pick an area that's got more fatty tissue. You can also inject it on the inside leg, where there is a bit of fatty tissue there, or in the back of the arm, making sure to avoid any visible blood vessels so that you don't cause any bruising. I tend to prefer my tummy when I inject, and all I do is either pinch or stretch the area, stab the injection in, and then push the entire dose so that when you've finished injecting, the 0 is back in the window.